watching the Baltimore station that works for you. ABC2 News. Good Morning Maryland at 9.
All right, well, this is also the time of year when your kids, they're out and about, they're playing sports, and that can lead to injuries. Dr. Robert Keehn, a pediatric orthopedist, is here. Good morning.
Good morning. Pleasure to be here.
All right, April, you said, is significant to this.
That's correct. April is the month which is designated the National Youth Sports and Safety Month, and roughly 5 million children and adolescents go to the emergency room every year for related injuries from the playground and from sports.
And you probably see this in your office all the time.
I see it 5 days a week, and on Monday we see many patients, many children that come in because of the Saturday and Sunday injuries.
And a lot of it, you said, is preventable. You actually gave us some good tips, so maybe I could ask you about them and you could sort of explain them. One of the things that you said is, if you're playing a sport, know the rules and abide by the rules of the game.
That's correct. The coach needs to know the rules, and the parents should know the rules, and of course the athlete needs to know the rules. One of the things that we want the children are to be active and to have fun. That's the most important thing.
Sure.
And you know that across the country now, obesity is a big problem, so we want them to be active and play and have good self-esteem from playing. When I see children on Monday mornings, one of the problems I see is a condition where the parent is on the slide and they're holding that 2-year-old. And what happens is that the parent goes down the slide holding the child's leg gets caught, and they sustain the fracture of their leg. And that's a preventable injury. That child then has to be in a cast for 6 weeks or so and can't walk around. Those are things that we need to know. So I would advise all parents never to go on the slide. Let the child go on the slide alone and watch them.
That's interesting, because I think a lot of parents would make that mistake.
And I don't think they know that.
Okay,
and we see that a couple times a month.
Okay, protective gear. You said absolutely wear it.
It's very important when they're doing any kind of activity such as biking or rollerblading, roller skating, is to surely wear a helmet. And every time I see a youngster that comes in with a fracture or a sprain or a contusion, I always ask them, did you have a helmet on? Because if they don't, they're going to wear a helmet the next time. And of course I emphasize that both with the child and with the parent.
Absolutely, you got to learn it from somewhere. You also say know the equipment.
Well, the equipment's important. If one's playing baseball, they need to have a helmet that covers the side of their face so they don't get hit. When we're playing soccer, we need to have shin guards so they prevent injuries to the leg. So all different sports require different equipment, and we need to know how to use them properly.
It was so hot yesterday. I'm sure that hydrating is an issue, and obviously not, you know, when it comes to like a broken bone or something like that, but it's probably something that a lot of doctors see with kids.
One of the most important things is to keep the child hydrated, and